Hello, guys, and welcome again to this new show, this crazy show by Austin Monara, limited edition series. Uh, this is episode 2, and in this episode, we're going to look at bipolar disorder. Now, in bipolar disorder, it's widely recognized as the disorder which people usually have multiple personalities. So bipolar disorder, patients have multiple personality disorder, which they usually believe like there's someone at this moment and then another version of themselves in a different way. So extreme cases are known to have like severe multiple personality experiences which are really crazy. They're really bonkers. So bipolar disorder has also been recognized for having mood swings. For example, sadness, depression. You also experience lack of sleep. Uh, Bipolar disorder also uh, bipolar disorder it's actually a mental illness. Mood swings, lack of sleep, sadness, risk-taking behaviors, lack of concentration, uh, unwanted thoughts. It's known to be the second most extreme mental disorder case of the mental illness out there, right? So bipolar is is a bit more mild compared to what we've looked at in the past. It's a bit more mild, but uh, bipolar patients can really be scary. If you ever met a bipolar patient, you would be scared. For the examples we've been exposed to on television, guys that uh, sometimes think they're little girls, thieves, old people, the cases that I've been exposed to personally really spoke to me because that was an extreme case of mental illness, and if not treated could be really dangerous because some of the patients have been known to become violent at some point if not treated, so they could be really dangerous. uh, So, what else? So, bipolar is definitely part of the crazy series. It's fresh, it's dope. Mumble rap for sure. So the whole series is definitely kind of mumble rap because crazy is definitely part of mumble rap, and bipolar is not an exception. Bipolar is definitely mumble. Hey, the chicks, they're coming in. I must be eating right. What else? So, uh, so bipolar disorder, as I've seen in the past, you might experience a bit of weight loss. Uh, um, yeah, it's there. It's been around for ages. I think bipolar came about around the 1700s, 1600s, I think, because of lack of treatment. The treatment now is with us. So these days you could actually experience bipolar disorder in a more pleasant experience in a psychiatric institution. You could be well taken care of. There's food, there's television, there's movies, there's games, board games. So if you were actually diagnosed with bipolar disorder, you wouldn't have to suffer, and you won't end up in a killing spree thinking like you're a murderer or something. So what can I say? Split personalities. It's a big issue in the bipolar mental illness case. They usually experience split personalities. Uh, they've been known to be dangerous, right? But sometimes it could be funny, sometimes it could be scary, sometimes it could be dangerous. Uh, I don't know. So I don't know if there have been cases of murderers who have been sentenced with bipolar disorder. I haven't heard of it yet, but I wouldn't be surprised. I wouldn't be surprised. Uh, so bipolar is actually, you know, on a personal basis, bipolar would be something interesting to have. I don't know how you think you're a girl or an old person or like a clown, or I wouldn't know how that would actually work, but to my mind it just makes me wonder, right? You think you're some stuff like a servant, right? And it would be that bad, right? I don't know how people lose touch with themselves to that extent to believe that they are somebody different, even to the extent that you're a different gender or a different age. Well, maybe a different age, but sometimes this stuff are shocking. What I do know, what I do know is the statement for it right now. I've looked it up on the internet a few minutes ago. There's definitely treatment for it. Quintipill. Quintipill. That's what I was. Quit. And amongst other something. These are some of the medication people take for mental illness today. Yeah, bipolar disorder is pretty interesting. I don't know what specialists would say right now. Uh, personally, personally, I've been to some of these institutions. I've taken a short course. Uh, I was there trying to detox from my addiction to smoking. I was experiencing smoking at an alarming rate. So I went for counseling, and we sat side by side with psychiatric patients. Uh, so we took some of the same classes. So that you can see I'm here, right, working on the bipolar. Yeah, uh, we'd call me an ex-con, an ex-student, an ex-patient, one of them, one of those guys. Really, there's a lot that goes into it, but what I have studied and what I have realized is there's a lot that you could experience about the illness, uh, but the best part of it is that the medication is with us right now, and bipolar doesn't have to be terminal, or it doesn't have to really have to ruin your life. Like, there's some of the patients out there who are living a full, fruitful life with families, putting their dark days behind them. Yeah, they might still be taking their medication, right? But but it's all good. You can uh, what else? Well, it's a high rated mental illness, that's for sure, right? Uh, yeah, the treatment is with us, but it's a really dangerous one. Some cases like could go to clown level of madness, like believing you're a serial killer or psychopath. So it's been known to be dangerous, right? Uh, so mumble rap, yes, it is mumble rap. Bipolar, we're going to look at it in mumble rap. As an expert, as a mumble rapper personally, crazy is mumble rapping, and that's why as a mumble rapper I took to come and discuss it in the show. We could briefly explain it. Sometimes you drop it in a song and people don't understand such parts. You don't have enough space to actually talk about such matters. So bipolar is definitely mumble rap. It's definitely fresh and it's definitely fashionable, right? So bipolar and mumble rap go together, right? And this is episode 2, bipolar disorder. Till I see you again.